Okay, so today my presentation is going to be on MRSA wounds. So what is MRSA? MRSA stands for methicillin-resistant Staphylococcus aureus, a type of staph bacteria that is resistant to several antibiotics and may cause skin and other infections. Reservoir. Most MRSA infections occur in people who have been in hospitals or other healthcare centers such as nursing homes and dialysis centers. When it occurs on these settings, it's known as healthcare-associated MRSA. HA-MRSA. MRSA lives harmlessly on the skin of around 1 in 30 people, usually in the nose, armpits, groin, or buttocks. This is known as colonization or carrying MRSA, and for this, you don't have to be treated. Portal of exit. Drainage from an open wound. The portal may be a hair follicle, but usually it's a break in the skin. Mode of transmission. The main mode of transmission is through direct contact with the wound, discharge, or soiled areas, or by sharing personal items such as towels, razors that have touched the infected site. Portal of entry. Infected agents into the body through various portals of entry, including the mucous membrane, non-intact skin, respiratory tract, gastrointestinal tract, and urinary tract. Suspectable host. Anyone can get MRSA. The risk increases with activities or places involving crowding, skin-to-skin contact, and shared equipment or supplies. Non-intact skin, such as when there is an abrasion or incision, is often the site of MRSA infection. Athletes, daycare and school students, military personnel in barracks, and others who receive inpatient medical care or have surgery or medical devices inserted in the body are at higher risk of MRSA infection. Signs and symptoms of a wound being infected with MRSA. MRSA infections often appear as a bump or infected area on the skin that may be red, swollen or painful, warm to the touch, full of pus or other drainage. It is especially important to contact your healthcare provider when MRSA skin infection and signs and symptoms are accompanied by fever. But it also depends on the part of the body that the infection is in. Some MRSA skin infections can have a fairly typical appearance and can be confused with a spider bite. However, unless you actually see the spider bite, the irritation is likely not a spider bite. So these are a few examples of how MRSA could look on your skin. It could appear as a boil or rash licking, as an infected area like a spider bite, or where MRSA has completely eaten through the skin with a severe staph infection. Okay, so proper protective measures. Keeping cuts and scrapes clean and covered with clean, dry bandages until it heals. The pus from the infection sores contains MRSA, and keeping wounds covered can help prevent the spread of the bacteria. Personal protective equipment that you should wear. The PPE that would be worn would be gloves and a gown. Mask wouldn't be needed at this point because MRSA in wounds is spread to skin contact or by contaminated objects. A mask would be needed if a patient had MRSA pneumonia because in that case, the infection would be airborne. Order of PPE application and removal. So first, you would wash your hands and get the appropriate size of gown and gloves. Then you would check the gloves and the gown to see if any of it has any holes or is torn. Then you would go on to apply your gown with the back side open towards the back. Then you would tie the neck first. Then you would overlap your back, making sure that your whole uniform is covered, and you would tie. Then you would look to see if your cuff already has holes, and if it doesn't for your thumbs, then you would proceed and go ahead and do that. Then you would apply your gloves, making sure they go over your cuffs. Then you would walk into the room because you would need to do this outside of the room. You would walk into the room, administer treatment to your patient. Once you were done administering your treatment, you would then proceed to take off your PPE. First, you would remove your gloves by pinching the first one and pulling off. then sticking 2 fingers with your clean hand into the following glove and taking that off and disposing of the gloves. You would then wash your hands or sanitize, whatever is appropriate. Then you would untie the back and then untie your neck. Then you would proceed to put 2 fingers into the cuff and pull to cover your hand. After your first hand is covered, you would pinch the other calf and pull down to cover your other hand. Once both cuffs are over your hands, you would then proceed to pull off your gown by pinching the center and pulling away from your body. You would begin to roll the gown into a ball and tossing. After you're done doing that, you would sanitize your hands and walk towards the door and walk out. Once outside the room, you would hand sanitize your hands one more time. Okay, now room preparation and setup. When possible, a patient with MRSA will have a single room or will only share a room with another patient that also has MRSA. There should be a setup outside the room with gloves, gown, and hand sanitizer. The room should be equipped with topical medicines and antiseptics to try to decrease the amount of staph in the person's body. Their room should also have a blood pressure kit, stethoscope, and paper and pen to write down vitals, because nothing should be taken in and out of the room to prevent further infections. Lastly, meeting psychological needs. You should respond to their call out promptly as possible so they don't feel neglected. Provide them with reading materials they like or anything else they might possibly want to keep them comfortable as possible. Hear them out and let them express themselves. Don't make them feel like they are the infection. Treat them as a human. And this was my presentation on MRSA.